Hello, good evening everyone. I welcome you all for this Oncofertility workshop. So we have kept a theme as let's team up for improving the quality of life for cancer survivors. So just a second. I just want to give you a brief overview that we are going to cover in this workshop. We have designed it such a way that initially we'll just discuss about the concept of oncofertility, then strategies of fertility preservation in females and males, and challenges we face in the ovarian stimulation in cancer patients, and most important would be the panel discussion, which is actually the most interesting session in this workshop, where we are going to discuss oncologists, team of oncology, as well as the fertility team. We will take different case scenarios, and then practically we will discuss that what are the challenges generally we face dealing with these kind of patients. So without wasting time, I would be starting my first session, which is the concept of oncofertility. So advances in cancer diagnosis and the introduction of new cancer treatments have dramatically improved the odds of survival, permitting patients and practitioners to think well beyond the cure to future quality of life. So basically now it's really a need of our that we should also consider the quality of life for the cancer patients, because the cancer is no longer the disease of age. The incidence of cancer is increasing significantly in adolescent and young adult population. So definitely, as we know that late effects of cancer treatments are majority on the reproductive and endocrine functions. There are difficulties in transition through the puberty. There can be delayed development of secondary sex characteristics. There can be different issues, medical issues like cardiac dysfunction or neurocognitive treatment impairment. So what the survival statistics they say? As we know, 85% of prepubertal cancer patients are likely to survive. And definitely, so we need to understand what are the concerns in the survivors. As we know, the concerns are like cancer recurrence, infertility, which gives most psychological impact on these patients, pregnancy complications, and risk of cancer transmission to offspring, especially in the genetic cancers. So definitely it has been seen that fertility concerns and desire to have family, these are most common survivorship issues. And one of the strongest predictors of emotional well-being of cancer survivor is parenthood, representing return to normalcy and the sense of fulfillment. And definitely receiving specialized counseling about reproductive loss and fertility preservation is associated with less regret and great quality of life for the survivors. So this is actually the importance of the fertility preservation. And definitely, what is the international standard of care? As all of we know, all the consortiums like Oncofertility Consortium, other guidelines like ESHRE, ASRM, as well as ESCO, everything, all the guidelines they say to provide clear and consistent information about the impact of cancer treatment on fertility and fertility preservation options where there is a curative intent. So this is very important. So just let's understand what is oncofertility. Now oncofertility is, as it is in the name, it is an umbrella term that includes care from both cancer and the fertility healthcare providers. So definitely here we need to team up. And it involves what? It involves the discussion about the risk to fertility due to cancer as well as its treatment, fertility preservation options, and cancer treatment related complications like pubertal delay, menstrual problems, hormonal deficiency, and sexual dysfunction. Now, providing detailed information to the patients and their families as well as the psychological support, it is an integral part of oncofertility care. So definitely, oncofertility was just an idea 15 years ago. So today, it is a distinct field of medicine, offering new hope to cancer patients who will survive their disease with option of preserving their fertility that prior generations lacked. And definitely the key components of oncofertility care are information provision, age appropriate communication, because we deal with all the populations like pediatric and mainly young adolescent population. Then financial support, which is also important, as well as the psychological support. So there are different challenges in the fertility preservation decision making. So I'll just brief you quickly because I don't want to go into details because our main focus is on the panel discussion. So there also we will discuss about these issues like especially ethical concerns, legal concerns and all. But now when that particular decision has to make, what generally we face. So basically, now these patients, the families, they have multiple sources of information, like from the doctors, from their families, their society, or whatever, on the internets and other things. And the cancer diagnosis itself is a very labile emotional time. Of course, they are struggling with the existence crisis, their survival, their future. And at the same time, when we are dealing with those realities, we have to, take decisions about this, about the future fertility. The time frame is very less to make the decision because we need to start the cancer treatments as early as possible. At the same time, it is very important to understand the reproductive function and the future fertility desire, which is especially difficult for young adolescent population. And even if they reach to that decision, another issues are where exactly this care is available, the availability, actual referral pathways, and then the financial constraints. So all these are the challenges we generally face. And why we are discussing these topics, because there is still less awareness about it. So collectively we have to make awareness about these facts, and we have to sort out these issues and make these things possible, accessible to majority of the people. So definitely there is something called a patient navigator or coordinator, which is very important person that coordinates with the fertility team and the clinical care team. He has to be reliable, sensitive. There should be an immediate response because time is a very important in all these situations. We can't even waste a single day. So this is something, a role of the coordinator. We will discuss in detail later on. And definitely there are certain guidelines for the counseling. Some are of course general guidelines, like these are the very sensitive discussions, private discussions. So we have to set environment accordingly. Clinician should lead the discussion. We have to give proper time. The discussion should start by giving a basic knowledge about the reproductive biology, which is mainly in the young population, because they may not able to understand the mindset. We need to really understand the mindset of the patient and the families at the time of the cancer diagnosis. And of course, we need to give little time, proper information to be provided, maybe audio visual aids or with the help of information leaflets. And then we need to give time to process the information, to formulate the questions, all queries to be answered well. And of course, this is very important in the young population, especially even if children and all, parents should not speak for them. We need to make age appropriate counseling. This is something called age. We need to take a help of the counselors and all. And of course, we need, as per the maturity level, understanding level of the child or adolescent, we need to give the proper information to them also. And of course, the silence doesn't mean that they lack interest in this topic. It might be an initial reaction. They may not understand how to react to this. So there are different shared decision making tools also available. We can make use of that. Okay, so I'll not go in detail. So just here I wanted to show. So this is something, a clinical pathway for the oncofertility care. Basically this we lack. So as the importance of these kind of workshops are, we need to team up well, and we need to have these kind of the referral pathways where we actually know where exactly the care happens. So definitely when there is a problem and there is the first, there are patient need to start a specific, so patient need to primary options which they would have taken, and then the role of the coordinator, navigator, and then the patient will come to the oncofertility team, and then the further procedures would be done. So there has to be a proper handover from the oncology team to the fertility team. So in the form of course, brief history, and what main important, what we would like to know is how much time we have with us to give the proper option to these patients, and accordingly we can, when immediately we can start a treatment. So it is like what is the urgency, what is the prognosis, then of course we would like to know exactly what is the plan from the oncology unit. Then accordingly rest other different things I'll not go in a detail. And also we need to understand the medical risks of the patient. That is very, very important, because accordingly that gives us, further we need to, when we go for the procedures, there are anesthesia involved, so anesthesia risk is there, so we need to team up for that. And of course, there are social concerns of the family, if any, like custodial issue or parental disagreement. So these are the things. And then patient comes to the fertility facility basically. So we need to have, so these are few pictures of our unit. So where that is a cryopreservation unit, then we need to have the very well equipped IVF laboratory to deal with the gametes, and as well as the andrology lab and incubators and other things. So important is availability of these facilities, which is very, very important, because this is the key factor. And ultimately, this is the model of the care. So our aim is to develop this kind of the team, where the initially it will be like primary care, that is by the oncology team, where the patient is initially diagnosed, and then there has to be a proper referral pathway. So then it will be referred to the fertility team. It all fertility preservation team means it is like a fertility specialist, embryologist, andrologist, as well as the fertility nurse. Then it also involves the mental health professionals, counselors, then the finance counselors, as well as the patient navigator. So this is all the team. Then we understand the situation, we give the information, we take the decisions, and then accordingly the intervention. So whatever different strategies that we will see in the next lecture, like what exactly we have, the options, we finish that. And then very important, that patient immediately should go to the oncology team again here, because that is important. Important is right now to start the treatment. Afterwards, now the circle will complete when, after the treatment, after the follow-up, when the patient is again fit for the future pregnancy. That is also very important. That time it will again come back to us, and then accordingly we assess their fertility at that point of time. Then we assess whether they will need any further fertility treatments to make use of all these gametes which we have preserved. And afterwards, with the help of the oncology team again, then finally they can have their dream of parenthood complete basically. So that is the complete circle. But practically we are having these problems as of now in front of us. One is the information gap, one is a data gap, and one is an option gap. So right now still we lack to give the proper information to the patient, because the proper referral pathways are not clear. So it is very important to understand like where exactly these facilities are available, how we should be connected, how immediately we can give these services to the patient. Secondly, data gap, meaning we need to have the research which is well coordinated even from the oncology team as well as the fertility team, and accordingly we should be developing the other novel techniques. And option gap, this depends again, as I was talking, so we should be immediately able to provide options to the patient which should be well accessible. There shouldn't be any problems getting into the facility, as well as the financial and other considerations. So we need to basically work on these three aspects, and that is actually the aim of these kind of workshops, like how we can reduce this gap and how well we can develop such a kind of the programs. That is important, and that's why now it's time to merge. So that is like a oncology as well as the fertility team coming to a newer development of the oncofertility team. So we'll skip this to summarize. So basically all the patients and families have the right to know if their fertility is at risk, And even if there is, I'm just sorry, here the battery is low. So even if there is no time to do anything about it, there is nothing that can be done even if the prognosis is poor. So as per the guidelines, everyone should have the access about these kind of facilities, and everyone should discuss about it. Then when it is judged to be medically safe with all the information and support, the decision then rests with the patient and the family. Documenting the discussion is very important. So whatever may be the decision, but ultimately documentation about this discussion and the whatever decision has to be done. Sorry. And providing the written resources to the families is also important. So thank you so much. Next, I'll call upon Sangeeta for the next. She'll be talking about strategies of fertility preservations in the females and male. So we are just running through these talks because it is important that we are focusing more on the practical case discussions, which will start shortly by 7 p.m. Thank you.